Good morning, Raymond. You've been a healthcare IT analyst for a long time, so we wanted to document your experience here on the video. So tell us about your education background and how did you get into healthcare IT?
So I hold a bachelor's degree in biomedical engineering. I pursued biomedical engineering in PhD College of Technology, Coimbatore, one of the leading institution in Tamil Nadu. From there, I got an opportunity to work in the healthcare IT.
Okay, and where was your first job and how have you progressed since?
So my first job is with Accenture Chennai. When I started my career, they gave me some training on the testing field, manual and automation testing. Once the testing is cleared, then fortunately, I got opportunity to pitch into this healthcare. And then I quickly realized the impact technology can have on patient care. So once I transitioned into the healthcare IT project through Accenture, where I worked for one of the leading hospitals in US, I support them. So that experience sparked my interest in EHR, especially in Epic platform, and lead me to specialize in Epic.
Okay, so what modules are you certified in and where all have you worked?
So I certified on Epic Grand Central, Prelude, and also eligibility module. Basically, these are Grand Central is basically patient movement tracking, so basically for admission, discharge, transfer. So census management, how many beds are there in the hospital, how many beds are open to admit, how many patients are admitted there, how many beds are under maintenance. So these kind of bed management details we are handling, and also in Epic Prelude, we take care of workflow design, in registration workflow design. Basically, in any clinics or hospital, they want to see different screens, they want to see different forms. They're collecting different options or different questions from the patient. So we design using the Prelude module, we can design the workflow of how the front desk want to see. And also Epic eligibility module is basically it's between payer and the Epic module. So Epic, like, it's an integration between the hospital and the payer. So whenever the patients comes in the registration desk, and if they want to check the eligibility of the coverage, so this eligibility module will help in quick registration. So it is actually giving a message to the payer through integration, and we will get the response from the payer in a message format, and Epic will convert into a meaningful format, saying that the patient is covered, this patient is not covered, so and so on. And what are the specialities, like what are covered, what are not covered, those details can be captured in Epic eligibility.
Okay, so you mentioned 3 different modules and certifications in Epic. So
Yes.
in layman's language, someone who doesn't understand all these technical details, why is this beneficial for the hospital? And more importantly, why is this beneficial for the patient?
So in healthcare perspective, for the patient, we give more attention to the patient experience, how they are getting it. I want to say from my experience, okay. So I went into an hospital for a physiotherapy treatment, okay. So I reached the hospital on time and gave all my details, and they told, you are ready. We will call you in next 5 minutes or 10 minutes. And I've been waiting there for half an hour or 45 minutes or almost 1 hour. And I reached to the front desk and saying that I came on time, I complete my registration, but still it's more than 1 hour I've been waiting here. So what's the problem? Then they told that we have put the system, you have come, you have arrived to hospital, but the clinicians doesn't know that in their screen that you haven't reached here. So that is the problem. So this is the basic example I'm giving. So to think about in a very in a real scenario, the patient who actually have a lot of health problems, who definitely need solution from the clinicians, came hospital on time, but you doesn't get that, like, if you are being delayed because of the technical reasons. So you have to understand their perspective. The patient have to suffer a lot on the time. So as a technician, as a clinician, like, the Grand Central module will definitely help you in admission perspective. What are the details we are going to capture? What are the insurance? Say, for example, we can collect the insurance in advance, and can't have a have a constant communication with the patient saying that your insurance has been approved for the service and you have to pay this much of amount out of your pocket. So these kind of communication we've been already giving in advance to the patient so that they can get a good knowledge. Okay, this is what they can set their expectation. This is the amount of that I'm going to spend to the hospital. And also, this is the things services are covered under insurance, and rest all services I need to take care of out of my pocket. So these kind of details we actually can be like how effectively the registration how much effectively we are making the registration process easier for the patient so that they don't need to wait in a strong like long queue. So we have to reduce how to reduce the long queue. So we can put a kiosk machine. So we can put a person next to there, and if the patient facing any issues in registration, so we can also help. We can skip the queue so that the next patient get an opportunity to see the patient or something like that, to see the clinicians or something like that. So this is how, in registration's perspective, it actually we are thinking like we have to think holistically how these things are going to actually affect the patient. So based on thinking all of this, we have to define a solution technically how we can optimize the registration workflow or something like that.
Okay. What about insurance issues? I hear it's one of the biggest things patients are worried about when they're at a hospital. So how does this help with insurance billing?
So insurance basically most of the time the load has been taken by the registration staff or the backend staff. So they are the one who actually do the heavy lifting when when connecting with the payer and giving all the details necessarily to get the approval. So they are in bridge between the payers and also the clinicians to get any diagnosis code is missing or something like that. So the registration staff actually collect all those details and get necessarily whatever the load they can, like whatever the help they can do to get the approval. So actually they are doing it actually. Some cases the insurance may not approve some services. So that will cost them the high cost procedures. So sometimes they might not covered based on the premium they pay. So these are the issues the premium based on the premium they are paying, they're not getting those services. So patient has to be very cautious while selecting the plans from the payers. So what essentially needed, whether their primary problem is for dialysis or their primary problem is to treat for cancer, so they have to think all this, which hospital they are going to choose, whether this hospital is covered under my insurer covered this hospital or not. So these kind of things, the patient has to be very much they have to carefully select their plans, because if they are selecting a plan for a very less premium, so at the time they need for a care, so the insurance might say that we are not going to cover on this. So these kind of problems actually the patient is actually facing, and sometimes though they might not have a good knowledge while purchasing the plans. So because of that, they are going to they're going to be affected very lot. So they have to be very cautious in that.
Okay. How did you get your certifications in healthcare IT?
So healthcare certification, I would say this is not something like you can get an AWS or machine learning or whatever the outstanding IT skill sets is available in the market. You can get it from any trainers or any applications which offers those learning platforms. I say, for example, Simply Learn, Udemy. This actually teach very much good IT skills DevOps or something like that. But when considering Epic, we are not exposed to there. So it is actually specifically streamlined by Epic, Epic organization. So if you want to get into an Epic, you have to work in a hospital who actually using Epic. So from there only you can get an exposure, either your higher level management see your talent in IT and they want to give you an opportunity to get a certification in Epic. So they are the ones actually deciding how you are getting certified. You cannot directly approach to an Epic organization, give me a certificate that is not going to work. You have to be in associate with any hospital or any organizations or any IT organizations who actually supports Epic or who actually using Epic. So from if you're getting into that company, you can have a chance there. You can talk to your manager asking that I want to I want to I have much interest in healthcare IT projects. I want to work in EMR. I want to work in EHR. If you express your interest, if the organization currently supporting, that is the one way you can actually getting into it. But it's very limited actually.
Okay. So you worked in multiple countries. So what do the salary ranges look like in India and what do they look like in the Middle East?
So currently for a fresher, their starting package they're getting 6 lakh per annum. For 10 years experience, they can scale up to 18 to 20 lakh per annum. But in Middle East, you can get a little more compared to India.
Okay. What is the best and worst thing about being a healthcare IT analyst?
So the best thing I would say, the problem solving, the amount of work or the technical things you are doing in the system, it actually you can see the benefits in the hospital. So we can reduce their registration people time load, and also you can reduce the patient wait times for the registration. So these kind of little impacts that will actually give you better motivation to work actually, because you are not giving care patient physically, but you are technically you are supporting in somehow you are giving a good patient experience and also end user experience. So this is the one thing you can be happy about when working in Epic. But the sad thing or worst thing, no, I'm not going to say it's a worst thing, it's a challenging thing, I would say, during the project, like go live or upgrade times. So you can definitely have more workload. Also, the more expectation from the operations will also put you a pressure, and how we can going to design these solutions. And also, if all together comes, then that is going to be a challenging thing for Epic, for an Epic analyst, I would say. But I don't think it's a bad thing. It's a challenging thing.
Okay. Do you recommend this job to any youngster who's now graduating?
Yeah, definitely. So whoever interested in problem solving and also loves technology and also wants to be in a healthcare field, then definitely I would recommend Epic is one of the best thing for them. So the Epic has advanced functionalities and more flexibility, and like the continuous development of the software. So they definitely like challenges you to be upgraded year by year. You have to be upgraded. So that is the situation Epic puts you in. So you have to be you can think that you are in a better place.
Are there growth opportunities with this kind of a job profile?
So growth opportunities, I would say, you can go for a project management, which is related to Epic project. In Epic projects, you can go for project managements, and if you are strong in clinic and also you have a technical knowledge, you can go for informatics. So you can give you an advanced level, high level data, or that will actually help the clinicians or the leadership to take data driven decisions. So you can go for informatics. And also, if you want to be a manager or want to be a director, if you have a very good strong communication skills, and also if you're strong in managing the work, you can definitely have this growth in Epic. And also, it's a long run. You cannot get in a quick way, but you have to wait patiently for this.
Okay. What is your one piece of advice for that youngster out there who's probably finishing engineering or a borderline clinical degree and wants to get into healthcare IT?
So I would advise them keep up to date of the technology that is available in the market, and also which technology actually have a demand, and how it is going to be after 5 years. So these kind of things, the people like who are coming out of the college, they have to be prepared, because the AI is doing slowly, slow by slow. So they have to keep searching, focusing on how AI is developing in healthcare, what are the technical skills that will create demand or create work. So this kind of awareness, the the students who coming out of the college, they have to be aware of, so that they can be well prepared and they can train themselves or skill themselves on which is the demanding field instead of opting for non-demanding skills.
Yeah. Thank you so much, Raymond, for joining. We appreciate all the help.
Yeah, thank you, Divya. Thanks for your time and thanks for the opportunity you have given to us.
Thanks.